Stomach cancer, also known as gastric cancer, is a malignant, cancerous growth that develops in the cells of the stomach lining. It typically begins in the mucus-producing cells of the innermost layer of the stomach and can gradually spread to other parts of the stomach and nearby organs if left untreated. Stomach cancer often progresses slowly and may not cause noticeable symptoms in its early stages. According to the World Cancer Research Fund statistics at that time, stomach cancer was estimated to be the fifth most common cancer worldwide in terms of new cases diagnosed, and the third leading cause of cancer-related deaths. The exact number of people affected by stomach cancer worldwide can vary from year to year. Risk factors of stomach cancer: age. The risk of stomach cancer increases with age. It is more commonly diagnosed in older adults, typically over the age of 60. Gender. Men are more likely to develop stomach cancer than women. Family history. Individuals with a family history of stomach cancer, especially in close relatives, parents, siblings, have a higher risk of developing the disease. This suggests a possible genetic predisposition. Helicobacter pylori infection. Infection with the bacterium Helicobacter pylori is a significant risk factor for stomach cancer. This bacterium can cause chronic gastritis and stomach ulcers, which may lead to cancer over time. A diet that is high in salty, smoked, pickled, or processed foods is associated with an increased risk of stomach cancer. Consumption of nitrate-preserved foods and low intake of fruits and vegetables may also contribute. Tobacco and alcohol. Smoking tobacco and excessive alcohol consumption are risk factors for stomach cancer. Obesity. Being overweight or obese has been linked to an increased risk of developing stomach cancer. Previous stomach surgery. Individuals who have undergone certain types of stomach surgery may be at an elevated risk. Pernicious anemia. This condition, which affects the stomach's ability to absorb vitamin B12, can increase the risk of stomach cancer. Occupational exposures. Some occupational exposures, such as those to certain chemicals and dust, may be associated with an increased risk. Most common symptoms of stomach cancer: unexplained weight loss, persistent abdominal pain or discomfort, difficulty swallowing, dysphagia, nausea and vomiting, feeling full or bloated after a small meal, early satiety. Less common but still important symptoms, such as blood in stool or vomit, fatigue, jaundice, yellowing of the skin and eyes. Stages of stomach cancer. The most commonly used staging system for stomach cancer is the TNM system, which stands for tumor, nodes, and metastasis. This system classifies stomach cancer into stages ranging from 0 to IV, with each stage indicating the extent of cancer progression. Here's an overview of the stages. Stage O, TIS, N0, M0. This is also called carcinoma in situ. Cancer cells are found only in the innermost lining, mucosa, of the stomach and have not invaded deeper tissues or spread to nearby lymph nodes or distant organs. Stage 1, T1, N0, M0. Cancer has invaded the deeper layers of the stomach lining, but it has not spread to nearby lymph nodes or distant organs. Stage 2, T1 or T2, N1, M0. Cancer has invaded deeper layers of the stomach and may involve nearby lymph nodes, but it has not spread to distant organs. Stage 3, T3 or T4, N2 or N3, M0. Cancer has invaded deeper layers of the stomach, nearby lymph nodes, and possibly nearby organs or tissues, but it has not spread to distant organs. Stage 4, NET, NEN, M1. Cancer has spread to distant organs or tissues, such as the liver, lungs, peritoneum, the lining of the abdominal cavity, or distant lymph nodes. Diagnostic process, including physical examination and medical history imaging tests, e.g., endoscopy, CT scans, biopsy to confirm cancer. Treatment options. Treatment for stomach cancer, also known as gastric cancer, depends on several factors, including the stage of the cancer, the location of the tumor, the patient's overall health, and their preferences. Stomach cancer treatment typically involves a combination of therapies, which may include surgery, chemotherapy, radiation therapy, targeted therapy, and immunotherapy. Here is an overview of these treatment options. Surgery. Surgery is often the primary treatment for stomach cancer, especially in the early stages when the cancer is localized. The goal of surgery is to remove the tumor and any nearby lymph nodes that may contain cancer cells. Different surgical procedures may be performed, including subtotal gastrectomy, removing part of the stomach, or total gastrectomy, removing the entire stomach. In some cases, minimally invasive techniques like laparoscopic or robotic surgery may be used to reduce recovery time and postoperative complications. Chemotherapy involves the use of drugs to kill cancer cells or slow their growth. It is often used before or after surgery to shrink tumors, destroy remaining cancer cells, or reduce the risk of recurrence. Combination chemotherapy regimens are commonly used in stomach cancer treatment. Chemotherapy can have side effects, including nausea, fatigue, and lowered blood cell counts. Radiation therapy uses high-energy X-rays or other forms of radiation to target and destroy cancer cells or shrink tumors. It may be used before surgery to shrink tumors, after surgery to kill remaining cancer cells, or as palliative therapy to relieve symptoms in advanced cases. Radiation therapy may cause side effects such as fatigue, nausea, and digestive problems. Targeted therapies are drugs that specifically target molecules or pathways involved in the growth and spread of cancer cells. Trastuzumab and ramucirumab are examples of targeted therapies approved for the treatment of certain advanced stomach cancers. Targeted therapies may be used in combination with chemotherapy. Immunotherapy aims to stimulate the body's immune system to recognize and attack cancer cells. Immune checkpoint inhibitors, such as pembrolizumab and nivolumab, have shown promise in some advanced stomach cancer cases. Immunotherapy is typically used when other treatments have not been effective, and it may have fewer side effects compared to chemotherapy. Supportive care. Supportive care focuses on managing symptoms and improving the patient's quality of life. This may involve dietary counseling, pain management, nutritional support, and emotional support through counseling or support groups. Palliative care is an important component of stomach cancer treatment, especially in advanced cases. It focuses on relieving symptoms, managing pain, and improving the patient's comfort and quality of life. Preventing stomach cancer involves reducing risk factors and adopting a healthy lifestyle. While not all cases of stomach cancer can be prevented, these strategies can help lower your risk. Helicobacter pylori, H. pylori, infection management. If you're infected with H. pylori, which is a major risk factor for stomach cancer, seek treatment to eradicate the bacteria. This may involve antibiotics and medications to reduce stomach acid. Dietary choices. Fruits and vegetables. Consume a diet rich in fruits and vegetables, as they contain antioxidants and nutrients that may help reduce the risk of stomach cancer. Limit processed foods. Reduce consumption of smoked, pickled, salted, and processed foods, as these may increase the risk. Moderate salt intake. High salt intake is linked to stomach cancer. Limit your consumption of high-sodium foods. Cautious with nitrates. Minimize intake of foods and beverages high in nitrates, as they can be converted into cancer-causing compounds in the stomach. Increase fiber. Foods high in fiber, such as whole grains, can help reduce the risk. Healthy lifestyle choices. Tobacco and alcohol. Quit smoking, and limit alcohol consumption. Both are associated with an increased risk of stomach cancer. Weight management. Maintain a healthy weight through diet and regular physical activity, as obesity is a risk factor. Regular exercise. Engage in regular physical activity, as it can help reduce the risk of cancer. Food safety. Practice good food hygiene and safety to avoid infections with bacteria like H. pylori and others that may increase stomach cancer risk. Regular medical checkups. If you have a family history of stomach cancer or certain genetic conditions, discuss your risk with a healthcare provider. They may recommend screening or surveillance. Reduce exposure to carcinogens. Limit exposure to workplace chemicals and substances known to be carcinogenic. Considerations for high-risk groups. If you belong to a high-risk group, e.g., have a family history or genetic predisposition, consult with a genetic counselor or specialist for personalized risk assessment and management. Remember, the choice of treatment and its success depend on the individual patient's specific circumstances and the stage of the cancer. It's crucial for patients to work closely with a multidisciplinary healthcare team, including oncologists, surgeons, and other specialists, to develop a personalized treatment plan that addresses their unique needs and goals. Early diagnosis and intervention can significantly improve the outcomes of stomach cancer treatment.